everybody. Welcome back to Connecting the Dots, where we will break down today's most pressing issue through the lenses of justice, health, and lived experience. I'm your host, Serena Dennis, and in this week's episode, we're asking a tough question. What's fueling the rise in youth crime in New Jersey, and what can we actually do about it? My final project investigates the environmental and social justice issues behind the alarming rates of youth crime in some of New Jersey's most overburdened communities: Essex, Camden, Atlantic, and Middlesex counties. These communities aren't just grappling with poverty and underfunded schools, they're also facing higher pollution levels, limited mental health care services, and systemic disinvestment. And here's a quick disclaimer that mental health issues and autism, like race, are not direct indicators of someone's likelihood to commit a crime. Okay, let's now connect the dots. Firstly, let's talk about the overwhelming pollution levels in some of these communities. Newark Mayor Ross Baraka even quoted, "In a city struggling to dig out from under decades of environmental injustices, the state's greenlighting of Passaic Valley Sewerage Commission's construction of Newark's fourth gas-fueled power plant comes as an assault that we are prepared to fight in court. Already fouled by New Jersey's largest garbage incinerator, choked daily by diesel fumes from thousands of container trucks, littered with more than its share of smokestacks and toxic refuse, Newark considers this decision a slap in the face to every resident. We deserve better." I agree with Newark Mayor Ross Baraka. The state's approval for the PVSC's plan for this plant's construction will only make Newark's air quality worse. PVSC, or the Passaic Valley Sewerage Commission's plan, is to operate this gas plant for testing and maintenance more frequently than necessary. Jonathan Smith, who's a senior attorney with Earth Justice, explained these consequences, stating that the startup and shutdown periods are when those plants release the most pollution, which the PVSC stated that they're going to do it more frequently. Also, the PVSC is proposing to burn hydrogen in these gas plant turbines, which leads to even higher nitrogen oxide emissions. In Newark, a recent Rutgers University study by Gregory Bruno revealed that troubling rise in autism diagnosis among children. Researchers found that autism spectrum disorder cases increased significantly between 2000 and 2016, particularly in urban and low-income areas, such as Newark. The authors noted that increased rates may reflect both heightened awareness and possible environmental risk factors. This points to something bigger. Kids growing up in these areas like Newark may be disproportionately exposed to conditions that may affect their neurological and mental development. Foodandwaterwatch.org published an article on April 20th of 2022 highlighting a letter sent by over 100 health professionals to Governor Phil Murphy and the Passaic Valley Sewerage Commissioner. This letter highlighted the health inequities imposed by the lack of environmental protections for Newark residents. For example, Dr. Nikki Sheets, Esquire, the director of the Center for Urban Environment of the John S. Watson Institute for Urban Policy and Research at Keene University, stated, quote, "If PVSC is serious about their environmental and public health commitments, they should sit down with the residents of Newark and figure out how to make their waste treatment plant more resilient without further increasing the already unsafe levels of air pollution in the community and region." Also, I want you to note that air pollutants have already been linked to many health problems, including respiratory and cardiovascular disease, autism, learning disabilities, cancer, and neurodegenerative diseases. Another health professional said, besides systemic racism, environmental racism is another factor that impacts health, contributing to infant and maternal mortality rates in Newark. If this plan moves forward, it won't just raise emissions, it could intensify the very conditions that are harming children today: asthma, learning difficulties, behavioral health struggles. This is about more than just clean air. It is about mental health conditions as well, from anxiety to ADHD to depression, which are rising in areas where kids are forced to live with constant stress, pollution, and systemic neglect. A critical issue is the shortage of mental health resources in schools, particularly in areas like the counties I've mentioned. A 2023 report by Chalkbeat highlighted that over 200 school districts in New Jersey lacked adequate mental health professionals, such as counselors, social workers, and psychologists. This shortage disproportionately affects students in low-income areas where more than 20% of the student population receives free or reduced lunch. In response to these disparities, the state initiated a grant program to help these districts hire more mental health staff and increase diversity among professionals. Also, the New Jersey Department of Children and Families launched the New Jersey Statewide Student Support Services Initiative, establishing 15 regional hubs to provide mental health services to students across the state. However, access to mental health support services remained limited. A 2022 study found that Black and Latinx students in New Jersey had less access to school mental health staff today than they did a decade ago. The intersection of inadequate mental health resources and fluctuating educational funding creates a challenging environment for students and youth. Without consistent support, students in these communities are more vulnerable to the adverse effects of environmental stressors, leading to increased mental health issues and potentially higher rates of juvenile delinquency. Now we're going to look at the youth demographic information found on Attorney General Matthew J. Plotkin's website from May 9th of 2025. We can see that the Black and Hispanic population are the highest youth that are committed, waived, probationed, and paroled in New Jersey. And from my internship, I can say that the highest counties of committed and waived youth are in Essex, Middlesex, Atlantic, and Camden counties. I specifically wanted to point this out because it aligns with the same demographics and data collected from what I previously mentioned about the Black and Hispanic kids being the highest in New Jersey that lack access to mental health resources. Finally, I want to touch on the systemic disinvestment in communities. From my experience in my current job working at a nonprofit, I've heard stories from inmates themselves and from parents showcasing the lack of initiative from the government, from state officials, from county officials, from workers in prisons, and furthermore, for rehabilitation and for social support. I want to make it clear that I believe that this social support is necessary and a responsibility of the people I've mentioned because their actions directly contribute to the outcome. If we truly care about safer communities and healthier futures, we need to stop pouring public dollars into polluting plants and prison developments and start investing in what actually works: education, mental health resources, and community support. That means fully funding schools in struggling zip codes, hiring more counselors and social workers, and expanding mental health care, both in our neighborhoods and behind prison walls. Because no child's potential should be defined by their environment or forgotten once they're incarcerated. Let's connect the dots and demand better. Thank you.